Hello everyone, I am Dr. A. Kishore Kumar. I am consultant nephrologist and kidney transplant specialist working at Pace Hospitals, High Tech City, Hyderabad. Today I will be speaking about World Kidney Day and its theme. World Kidney Day is celebrated every year since 2006 and it is celebrated on second Thursday of March. And the importance of World Kidney Day global campaign is to raise awareness about the importance of kidneys among the public. Every year there is a separate theme based on which the awareness is created among the public and also in patients with kidney disease. This year's theme of World Kidney Day campaign is preparedness for the unexpected and support for the vulnerable. So here basically this theme tells about the preparedness for the unexpected events like wars, floods or earthquakes or pandemics like recent COVID-19 pandemic, and also about the support which is needed for the vulnerable people like patients who are suffering from chronic kidney disease, who are requiring dialysis or care for transplantation, and also other non-communicable diseases. So before discussing about this theme, I want to give a picture about the burden of kidney disease worldwide. So first, chronic kidney disease basically is a non-communicable disease. Non-communicable in the sense it cannot be transmitted from one person to another. Non-communicable diseases are chronic kidney disease, diabetes mellitus, hypertension, cancer, heart diseases, and also chronic lung diseases. The burden of this non-communicable diseases is in low and middle income countries. Ours being a middle income country, the burden of this non-communicable diseases is high in our country. And if you see worldwide, approximately 85 crores of 85 crores population is suffering from any form of kidney disease. Some other form of kidney disease is present in 85 crores of population. And out of this 85 crores, approximately 50 lakhs to 1 crore population is requiring some or the other form of kidney replacement therapy in the form of dialysis or kidney transplantation. So you can see that the problem of kidney disease is so huge. And if we take the numbers, the people suffering from kidney diseases are more than double when compared to patients who are suffering from diabetes mellitus worldwide or from cancer or from HIV AIDS. So the problem is huge and these are the vulnerable people. So coming to the theme, so preparedness for the unexpected. Recently there have been very tough times, like we all have been through, we all have gone through the COVID-19 pandemic from 2020. And it was very difficult phase for these vulnerable population, especially patients with kidney diseases. Many patients who were on dialysis could not go to their dialysis centers because of lack of transport facilities, lockdowns, lack of medicines and lack of dialysis facilities, because all the hospitals were filled with COVID-19 patients and the proper dialysis care was not provided to these patients. And because of this, many transplant patients and dialysis patients did not come back to dialysis centers after the COVID-19 pandemic peak. Maybe because of the lack of medications or proper care, they have died. Many of the patients have expired. So such is the huge problem at the times of unexpected events like floods, earthquakes or cyclones or wars or pandemics. So to prevent, this has been a learning experience for all of us, because any such event can happen anytime in the future because they are unexpected and we should be prepared for this type of events. So the preparedness for this will be at 4 levels. First level will be from the government level, because they should develop a proper emergency plan for management of these type of patients, especially kidney patients, for proper care and dialysis support for these patients at the time of unexpected events. Second one is the policymakers. Policymakers should devise strategies or plans to identify in the early stage these non-communicable diseases, especially the kidney disease, to identify, to treat them at the early stage so that they won't progress and the patient's care will be improved. And the third one is from the healthcare services point of view, from the doctors and the hospitals, they all should provide equitable support to patients with kidney disease at the time of difficulties, so that their care will not be hindered or delayed or stopped at the time of unexpected events. And at the last, patients should also be prepared for these times, like they should have proper supplies or emergency supplies for food, water, medicines and medical records, and they should also use the facilities of telecommunication to communicate with the doctors or their healthcare providers for proper care when they can't come or travel to the healthcare facilities. So before concluding this, I want to mention about the important golden rules for protecting our kidneys or preventing the kidney diseases from occurring. The first one is to be active and staying fit, and the second one is to eat healthy diet. Third one is to check your blood sugars and control them. Fourth one is to check your blood pressure and control it. And fifth one is to avoid smoking. Sixth one is to avoid taking the over the counter painkillers or any other medications. And sixth one is to drink adequate amount of fluids to stay hydrated. And the last one is to check your kidney function if you have any risk factors like diabetes, hypertension, overweight or obesity, or if any of the family member is suffering from kidney diseases. Thank you.